Okay, so this one is for the face, the head, the neck, and a little bit into the shoulders as well, depending on the time, because there's quite a lot to get through. So to begin with, I just wanted to do a little bit of anatomy and physiology, because the neck is the place where you get the most benefit from working on the triggers, but it's also the place you have to be a little bit careful about the blood vessels. So if you were to take your hands, maybe one hand to the back of your skull, right in the middle, where you feel your spine coming up into the skull, and just lift your head up, and you can feel the vertebra there. You can push quite hard. There's no blood vessels here. Feel the bony processes just below the skull in the center. That is C2, that's cervical vertebra 2. So C1 is above that, inside the skull. Okay, and if you were to put your fingers sort of level with the back of your ears, where you've got your mastoid processes, and point inwards, where the fingers meet is where C1 is. So C1 and C2, the atlas and the axis, are very special vertebra, and they can pivot the head and they can move the head in all sorts of different directions. So just start by putting your fingers behind your ears and just do a little bit of nodding from where you perceive C1. So it's sort of at the back of the mouth, isn't it? Okay, so this is the correct place to move our head. We can also do a sort of a seesaw, so going up and down, and that's quite a nice stretch for the suboccipital muscles. So we just got to be careful that we don't bend the neck further down. Okay, so seesawing and nodding. So it's good just to remind ourselves that this is the correct place to move our skull from. So we're going to just start with a vagal release, and we're going to drop the arms, drop the shoulders. We'll do a salamander. We're going to take right ear to right shoulder without hiking up the shoulder. And with the salamander, you can look down or you can look up. So we're going to look up to about, is it 11 o'clock or 1 o'clock for you? So this is going to connect you with one of the cranial nerves, but it's also going to go to a part of the brain that takes you out of not moving into moving. So it's a really good thing to do, is just to look to the side. It takes you out of being in that frozen state or paralysis or inactivity. And the beauty of the salamanders is it really targets C1 and C2. So it's going to help you with forward head posture, where the head is too far forward. It's going to increase the blood supply to the brainstem. It's going to do a whole load of things. It's also really good if you've got a stiff neck. So you do it about 30 seconds. You're looking for the sigh, the swallow, the deeper breath, the yawn. Sometimes coming out of this position is a little bit uncomfortable. You could put your hand under your head and just ease your head out of that. So drop the shoulders. You don't hike the shoulders up. Left ear to left shoulder. So you're trying to do the seesaw. You're just taking the ear to the shoulder. I can feel straight away I'm quite tight on this side. And you're looking up to what would be 11 o'clock or 1 o'clock. So where you get that posture where someone's head is too far forward and the neck is already starting to change its position, this is a really good one to remedy that. So just a little bit longer. I'm trying to make sure we do at least 30 seconds of this. It's also going to make us much more socially engaged and much more taking notice of what's going on. So everything we do from now on, our concentration will be improved. So maybe you just support your head to come out of that, and then just move your head and just see how that feels. So already you would have increased your range of motion and taken yourself out of that forward head posture. So suboccipitals, we're just going to do a little bit of an anatomy lesson. You've got the C1 up inside the skull, C2. You can feel the rim of the skull running across. So we've got suboccipitals that run across the back of the rim of the skull. And then we've got some that come down diagonally to C2. And then we've got some that are vertical. So what that does is it creates a triangle. I'll show you this picture here. It creates a triangle. Whoops, I'm trying to get the light off of the picture. There we go. So you can see that triangle of muscles. That's your suboccipital triangle. And if you look in the middle, there's a little yellow artery. Okay, so that artery, your suboccipital artery, is very deep. You're not going to hurt it with fingers. You're not going to hurt it with a ball. But if you were to use anything more than that, you could damage and rupture that artery, and it's something you just don't want to do. So you can't feel the pulse there because it's so deep, but fingers are fine, balls are fine. So you just want to make sure you avoid that place. I'll show it you again so you can just look at it. So the artery runs parallel with the rim of the skull in that little indentation at the back. And then if you want to look at the blood vessels, we've got blood vessels here. We've got our carotid and our jugular vein just next to the sternocleidomastoid. I think you're all really good on neck muscles now. I'm just trying to get the light off of the picture. There we go. And then, so they're the main ones that we worry about, sides of the neck. And then if you look here, there's a little one just under here. So if you put your fingers in there, that you might feel a pulse. So it's okay to massage in here, but just be very gentle. Okay, so just look at that one more time. So no arteries or blood vessels at the back of the neck. It's just in the just in this crease here in front of the sternocleidomastoid, a little bit underneath, and there's ones in that indentation at the back. So that's the end of your anatomy lesson. You'll be doctors by the time you finish doing all of this with me, hey? So one of my favorite vagal nerve releases is the suboccipital one. I want you to take your hands around your skull, put your thumbs on the muscles at the back of your skull, just below the dome, the round part of the skull, and just do some gentle inward and outward oppositional rubbing with the thumb. This is a great one to do because it increases the blood supply to the brain. So if you're not very good at understanding the techniques, you could just stay with the inward outward rub, myofascial release. But if you want to go a little bit more technical, just go to one side and just with your thumb or maybe your finger, just push inwards and push outwards and try and determine, does it glide more in one direction than the other? And if you can figure out which direction doesn't glide very much, so for me, on this side, it's outwards. You just glide the finger out until it sort of gets stuck. It sort of hits a block, and then just hold gentle pressure in that place. So really, you know, it's just firm but gentle pressure. You're communicating through the vagal nerve into the brain, just to relax, to let go. Got a nice swallow then. That was quite quick. Sometimes you get really quick responses to these releases. If you're not sure what I mean, just do the rub. So 30 seconds, 20, 30 seconds. Try the other side. Now for me on this side, it's the inward part of the movement that's a little bit stuck. So I'm gliding in until I hit my roadblock, and then I've just got firm, gentle pressure. So gentle pressure on nerves, firm pressure on muscles and trigger points. So the nervous system is a different approach altogether. It's just sending that message through the nervous system to the brain. Look at this, take notice of it, and deal with it. There's my sigh. It's a lovely feeling when you get that release. So if you've had your sigh or your swallow, you could just go back to your oppositional rub. So, you know, if these muscles are tight, you're going to get a stiff neck and you're going to feel, you know, uncomfortable. So remembering now that C1 is behind, it's at the back of the mouth, it's level with the mastoid process. C2 is that bit, if you lift your head up, you can feel the vertebra there. Either side of C2, you're going to do the vertical muscle. You're going to go up and down with 2 fingers. Again, it's light, firm, but light pressure. And the same thing applies if you've got the time and the focus. You could see whether it glides up or down. If it gets stuck, you just find the stuckness, gently press into that. So for me, it was down on this side. There's my sigh. And then once you've got your sigh, you go to the other side, up and down. Is it sticking? It's more upwards on this side. So it's not always going to be exactly the same. It's going to change all the time, every day. So you're just trying to figure out where it is today. Firm pressure. If you're not sure, just do your little rub. And like I've said before, you can do this anywhere, all the way down the spine, doing one vertebra at a time. If you've got pain, you can go directly to that site and then just do that oppositional rub right up against the spine where the nerves come out of the processes at the side. And that will just send a message through the nervous system just to relax and let go of that tightness in the muscles. So just turn your head and you should feel nice and relaxed. Warm and fuzzy is usually the way I would describe it. And you've increased your blood supply and you're much more socially engaged. So we're going to come to the capitis muscles. So the capitis muscles are those big, strong muscles that run up the back of the neck. So remembering we've got C1, C2 are the top ones. So we're working from C3. So if you look up and find C2, you're coming below that to C3, cervical 3, and you're going to do a sort of a pincer, sort of a snake bite grip, and whichever side your thumb is on, so for me it's on my left side, you're pressing your thumb into that thick band of muscle, and you're going to put your top hand on top of the thumb, and no, we'll do it this way. We'll put the hand on the forehead, and you're just gently going to push your head into your hand into your head, and use your thumb as the trigger point tool. Technically here, you could change that to a ball. So if your thumb doesn't like being used as the trigger point tool, you could get the ball and you could put the ball on that point and you could hold it with two hands. Also, I mean, we're sitting in a chair today, but you could do this just lying in bed or on the floor, and you could just use the pressure of the ball. So I've got a fairly medium to hard ball here, and that feels actually really nice. You could use your knobbler. So there's no blood vessels that you need to worry about at the back. Remember, they're at the front and underneath. And you're away from that triangle, you're away from that indentation. So where this ridge of muscle is, then next to it, you've got an indentation. That's the place you avoid. Okay, you could put a ball in there, but we're just slightly inwards from that. So C3, my C3 is quite active. So just take some nice deep breaths. So you can either do it with the ball or you can use the thumb and you can just press your head. So this gives you a really good pressure doing it this way, but your arm gets tired eventually from being up. So you might prefer to use the ball. So you could come down one vertebra to C4. And on this side's pretty active all the way down, I think. So all you need to do to set this muscle off is to be looking at something that's slightly to the side of you. So it could be your television, or maybe you sleep in a certain way. And it can just start to over tighten these muscles. This one's not so bad. So about 20 seconds, 30 seconds in each place. So C5, this one's a little bit more unhappy. So remember, you're at the back. If you start to come into the side of the neck, you're going to be touching on different muscles. They'll be sore as well, but you're at the back of the neck in that big thick band that comes down either side of the spine. So just take some nice deep breaths. So for me, C3 was the one that was really active. C5, C6. This one doesn't seem so bad. And C7 is just above that, it's sort of just above that big bump that you've got in the spine. So the big bump, the big vertebra is your first thoracic vertebra. So this is one that might be easier if you're lying down on the floor and you've got your body weight on the ball. Or you could put it in a sock and you could lean against a wall. Okay, so that's all that side. So I'm coming to the other side. So if you look up, you've got C2, you're just below that in the thick muscle on this side of the neck. And this one's pretty active as well. So if you hold it with 2 hands, you can use a lot more pressure, but you can relax your elbows and your arms a little bit more. So just try and melt into that ball. 20, 30 seconds, and then move down 1 vertebra. So each vertebra is probably about 2 centimeters. Just follow that muscle and just find those points of pain. So this one feels fine. So I'm moving down again. So C3, 4. Now I'm on C5. So if there's no problem there, you would just move on. You give it 20 seconds just so it's had a little bit of attention, and then move on to the next one, C6. Might be easier to do it with my other hand, and just give this arm a rest. This one's fairly active. And C7 is just above that big vertebra. So you've got small cervical vertebra, and then you've got a big thoracic vertebra, which sort of sticks out from all the rest, and that's called your CT junction, where you go from neck to thoracic. Just take the ball away and just see how that feels. Roll the shoulders, move your head, a few shrugs, and just see how that feels. So coming back up again, if you think about the vertebra, right up against the processes that come out the side of the vertebra are your multifidi, and they're like little tiny diagonal muscles that go from one vertebra to the one below. And then you've got your rotators, which are even smaller, and they're sort of horizontal and they go across. So you're going to be right on the spine, but you're going to be only using your finger pads. Come right up to, if you look up at the ceiling, you've got C2, and start with C2 and just come into the sides, come around the curve of the vertebra and just into the sides where the processes are that start to stick out from the side. So you're not going to do any harm with fingers, and fingers are great because you get so much feedback through the nerves in the finger pads, so that you can feel the tone of the muscle. And there can be some exquisitely painful places through here. When you've got tightness and problems with the triggers and in the multifidi, you're going to feel pain that feels more like it's pain in the spine rather than the muscles. It's going to be confusing. It's going to make it feel like it's a damaged disc or a damaged vertebra. So just keep coming down, come down sort of 1 finger at a time, right up against the sides of the neck. So I can feel around C3, C4. It's pretty tight here. I've been watching a lot of stuff on my computer, and just tipping your head like that is just not great for the neck. So I can feel quite exquisite pain on this side, and it's right into the spine. I can even feel it into my eye. So when you feel that pain in the eye, in the ear, you're really following the vagal nerve back into the brain. Ooh, that one's sore. So it's just on this side. So I'm just going to focus on this side. You could use a knobbler, but I just think fingers are so much better because they're intelligent tools. They're sending messages to the brain, so you get double the information. So this is something you could just sit quietly and you could just work down through the sides of the vertebra in the neck. I'm going down a little bit lower now. So interestingly, my muscles are tight on the left side, but the multifidi are tight on the opposite side. So that sort of suggests that as your head is turning, you're tightening up these muscles, but then you're upsetting the ones on the other side of the neck. So you just got to look at it from all angles. If your arms get tired, you could just drop one arm and work with one hand and just go to the side that you feel is more affected. So this is not a quick fix. You're not going to just go bang, bang, bang and just sort these out. You're just really exploring at the moment. Are there any areas of problem? And I might go back to those later on when I'm sat on the sofa tonight. I could just gently be just working into that area. So even 20 seconds, just, a little bit of massage in this area is going to make a huge difference to the tone and the state of these muscles. So these are your multifidi and your rotators, and we're only coming down to C7. But, you know, this would apply all the way down the spine. So you could, you know, lie on your back and you could use a ball or two balls, one either side, paraspinal, and you could go right the way down and work through multifidi in all of your spine, and it would feel amazing afterwards. Okay, so we've done the suboccipitals, but we'll just quickly go back to the directional rub. So we're going like this across the back of the skull. So if you've got problems with your suboccipitals, you're going to get pain behind the eyes. You're going to get pain that feels like it's more in the head than it is in the muscles. Pain in the forehead. You're going to have a stiff neck. It comes about because of forward head posture, faulty postures, emotional stress. These muscles are going to really tighten up. And as they tighten, they compress the blood vessels and the nerves. And so it's going to affect the blood supply to the brain. And often you've got satellites from this muscle group in the capitis muscles. So the master trigger might be here, but the satellites might be in the capitis at the back of the neck. So they're quite closely linked with as the head turns and nods and the chin drops down. So the temporal muscles are at the sides where the temples are. I'm just going to get my little chart out here. So start just either side. You can feel the indentation where the temples are. So it's going to be all the way around above, like an arc above the ear. So you could use, I like to hold my skull and use my thumbs. And it